Today we're talking about treating chronic migraines. I'm Dr. Victoria. I trained with a neurologist about a decade ago when botox got licensed for treating migraines. So I have over a decade of experience, and that extends to treating for orofacial pain, so including bruxism and TMJ joint pain. So what are chronic migraines? These are debilitating headaches that mean that you are unable to function, usually not able to get into work, unable to drive, not able to go and pick the children up from school, and for a lot of people it's so severe that they need to go and lie in a dark room. How does the treatment work for chronic migraine? We're using a toxin that works on pain receptors, so it really reduces that intensity of pain. In fact, the data shows that 50% of people who have 2 lots of rounds of treatments get at least a 50% reduction in that intensity. It's a little bit less with frequency, but it does mean that you're able to function, and that has a massive impact on your daily life. So what's involved? Well, we do a full head and neck examination. So that entails a full medical history to understand where your pain is coming from, and then a full examination of the head. So starting really here across the forehead, what we're looking at, what I'm feeling for is muscle tension and also tenderness in the head. We go back here, right behind the ears, down the back of the neck and into the shoulders. And so the plan is very then tailored and personalised for your experience of your migraines, because everybody is different. What's involved with the treatment? It's a straightforward treatment. It's a number of tiny little injections with minutest tiny little needle. You barely feel it, and that is into those muscle groups that have been identified as the areas that give you the greatest pain. I'm also very mindful that sometimes the source of headaches and migraines can come from TMJ and jaw pain. So we examine the whole of the face and neck, and it may be a bit of combination treatment into jaw, TMJ, and also up into the muscles of the head and neck. How soon will I see results from a chronic migraine treatment? You should start to notice results very quickly. The toxin starts to work within 72 hours. Really, full relief is between 2 to 4 weeks, depending on which muscles we're treating. So the bigger muscles take a little bit longer to relax completely. And I see everybody back a month after their treatment for a re-examination to get your feedback as to how much positive impact it's had on your life and your well-being. To also examine to see if there are any areas where you're still getting pain and tenderness, and to assess the whole head and neck again to make sure that all the areas that you're getting pain, might still be getting some pain from, or maybe are now getting a little bit of pain from, are treated at that second session. And that is an inclusive service, so there's no extra fees involved with that. What are the side effects from having toxin treatments for chronic migraine? Well, these are very few, because the toxin stays in the muscle that it's placed. So you don't get any systemic side effects like you get with some of the other chronic migraine drugs. It doesn't give you fatigue, it doesn't give you brain fog. It stays where it's placed. It has to be used judiciously so that it doesn't spread into some of the other muscles. So mainly the side effect is possibility of a little bit of bruising. If it's used down along the side of the mouth around here, we have to be careful of the anatomy of the face to make sure that it doesn't get into your smile muscles, or it can affect the way you smile. How well does toxin work for chronic migraines? The first cycle of treatment I generally see 50% of people get a good 50% reduction in their intensity. By 2 cycles, that is starting to climb a little bit, and by 5 cycles of treatment, this is a treatment every 3 months, 50% of people are getting a 75% reduction in the intensity of their migraines, and this is without any serious side effects.